Hello, everyone, and thank you for joining us for our 20-minute masterclass in proactive, preventative environmental services in long-term care and senior living. My name is Angelica Bellavia, and I'll be facilitating today's webinar. After the presentation, we'll open up the floor to questions, so please use the chat box in the bottom right-hand corner of your screen to send in your questions. Just be sure to send them to me or to all panelists so we don't miss them. I'd now like to introduce Bruce Ferguson, our cleaning, hygiene, and sanitation expert at Bunzl, Canada, who will present today's session. Over to you, Bruce.
Thank you very much, Angelica. Expert. Oh, pressure. Hey, thank you very much, everyone. Really appreciate you taking the time. I know, people have very busy schedules, and really appreciate you taking the time to jump on this. Important. I love the title of this one. Taking back control. We're in a position where we've obviously been through a year and a half of very tumultuous time, especially in the senior living space. We seem to have a little bit of a breathing room here right now, where it's it's time for us where maybe we could take a step back and just make sure we are going down the right path with our environmental services team. Keeping in mind and understanding the importance that environmental services plays and good, effective housekeeping programs play in the preventing the spread of infection through our environments, especially in that senior living space. I always like to say and highlight the fact that we know that hand washing is one of the most important things we can do to prevent the spread of infection, and people tend to forget, right, that when we're creating clean and healthy environments, housekeeping is probably the second most important thing that we can do in preventing the spread of infection. And so, as we take a look and we sort of regroup and we say, what was happening before COVID-19? Because some of the places where we are right now are just enhancing some of the challenges that we had. And I know people out there probably had extra resources, didn't know how to keep their staff busy, right? Before COVID, I say that a bit sarcastically, obviously, because we know that's not the case. In commercial cleaning industry, we know we have an average employee turnover rate of about 200%, and labor makes up 85 to 90% of our cleaning costs. It makes up the most important piece of what is required for our cleaning programs. We've always been centered around in senior living, around the resident care. It's about creating that healthy environment, about preventing infections from spreading through our environments, about making sure our not just our residents, but also our staff and our visitors in our homes when they come in are safe. And before, it's important to remember this has not gone away as well too, but before we were very focused on preventing the spread of infection still. But some of our catchphrases: influenza, C. diff, MRSA, norovirus, all the little things that we were dealing with in the past, and very important to remember we still deal with today. So I'll look at our current situation. COVID-19 definitely amplified the existing challenges and definitely created new challenges for us and for facility managers, and very importantly, created new challenges for our frontline staff and for our housekeepers, right, without question. But existing challenges always is infection prevention and control. And I'm going to highlight something here really quickly. And we used to always call it infection control. And a number of years ago, prevention was put in there. I think that's the key of what we're trying to accomplish here, is that prevention piece. Definitely have to control it if it happens, but we want to prevent it so we don't have to control it. So infection prevention has always been very paramount. We've been dealing with labor challenges, right? And and the efficiencies that come with that, always in that position of needing to do more with less, right? Unfortunately, there isn't a windfall of money coming down to us in any province, I don't believe, where we're going to be able to add a significant amount of resources to our environmental services teams, right? And so we're facing that even more so today, right? Because we're, again, with COVID, we're being asked to do more and more with less. We have increased environmental sensitivities. From an indoor perspective, we use chemistry, we use chemicals, we use a number of different things that potentially create sensitivities to the people that are around, not just our staff, but also the people that are around cleaners as they're doing their jobs as well too. I almost missed this, and this is extremely important. We're potentially are an aging workforce as well too, and ergonomics are extremely important. Workplace injuries and managing this and mitigating it and helping to reduce the chance of that is extremely important. We also have to be very cognizant of the outdoor environment, again, understanding that some of the chemistries that we use and such could we want to make sure we're doing whatever we can to minimize the effect on the outdoor environment, and all while we're maintaining that fiscal responsibility as well too, because money is not being thrown at us, obviously. And even if it was, we still want to maintain responsibility with it as well too, and be responsible there. And then new challenges, right? A pandemic hits. Who would have thunk? It's been a year and a half of craziness. A lot of people, never realized sort of what that could mean. We've had pandemic plans in place and such, but why do we have those in place? Well, here's why we had them in place. It created, we've always been having increased levels of care with an aging population and such out there. Residents in long-term care especially are getting older, and increased level of care is taking place. But through COVID-19, that was blown up through the roof, right, for the amount of increased care that was needed, increased levels of care that were needed. And an increased government presence as well too. Not necessarily a bad thing, right? But definitely puts more of an eyeball on us, right, and on what we're doing to make sure that we are doing what we say we're doing, and making sure that we are creating that healthy environment that we're trying to create. What did COVID-19 reveal? Look at the silver lining in something like this. You take a look back at SARS, you take a look back at H1N1, take a look back at MERS, right? When these things came to light, right? When these things happen, right? It came to light, and it always seems to remind us that how important environmental service and good cleaning practices are. But at the same time too, is those weren't pandemics. They didn't last a long time, and unfortunately things kind of fell back, and that importance kind of faded again as well too. I guess with COVID-19, it's been around long enough. I think there's a lot of education that's taken place, not just within our own environments, but also within the general public, to the understanding of the importance of effective cleaning and the importance of the role of a housekeeper, right? It's not considered a professional profession, yet it is a professional profession, right? It requires unique and skilled, specific skills to be able to do the work properly. But so during COVID, like we said here, is the priority of cleaning for health became paramount. Many facilities actually weren't prepared to take on the enhanced cleaning. We were already taxed, already stressed from an efficiency or from a labor perspective, and so we weren't ready to take that on, right? And it really, challenged a lot of facilities, a lot of companies out there, right? And environmental teams are asked to conduct additional cleaning. Again, that stress, same staff, more disinfection, right? Same staff, more frequent contact point cleaning, right? With potentially without additional tools or resources, really took us off guard. And so, we take this time now, we kind of sit back and say, okay, it's time to get creative, right? And optimize the resources that we do have. Again, we're not being thrown an enormous amount of resources. We're not being thrown an enormous amount of money to be able to add resources, right? So let's get creative. What can we do, right? What are some steps that we can take to take back control? So environmental services role, right? And in developing a future first approach, or a very proactive approach, if we want to call it that. Remembering that, we want to change the game, let's understand how environmental services does change the game, I think is important, and how we contribute to that resident quality of life. And we contribute to, our buildings being full, and, people being healthy within the buildings. And so very importantly, it does start with that visible clean, right? Obviously, if it doesn't look clean, it's not clean. So visibly clean, I think, is extremely important. The aesthetics are very important about that. And when we keep things visibly clean, and we have good procedures in place, we protect building surfaces. And I think that's a key as well too. We degrade building surfaces. It's not fiscally responsible, obviously, replaced before their life cycle, but also they become harder to clean, right? And harder to keep that healthy clean potentially as well too. So we got to protect our building surfaces, so important. And housekeeping plays a real significant role in that. From a safety perspective, right? Not just from a cleaning for health perspective or a healthy perspective, from a safety perspective, we are utilizing, various tools, we are utilizing various chemistries and such. Environmental services plays a great role in keeping the environment safe, whether it's a spill on the floor, right, whether it's wet floors, whether it's an entryway in the winter, right, making sure they're creating that safe environment indoors, right, keeping in mind sustainability, and having good sustainable practices in place, sustainable cleaning programs, using sustainable green products wherever we can, minimizing that impact to the outdoor environment. And last but very much not least, right, is that cleaning for health, right? And that's so important. point to the fact that environmental services, right? You want to stop the spread of infection. Again, wash your hands, right? You want to stop the spread of infection, right? Good, proper cleaning processes and procedures. I always like to, this little adage is from a infection prevention perspective, you take a look at, I say a door handle, and let's say I walk up and I touch that door handle, right? I mean, I got little bruise cooties all over my hands. I touch the door handle and I leave something behind the door handle. And then you come up afterwards and you touch that same door handle. And then you leave the room, but you sanitize your hands. You've just broken the chain of infection, which we're going to look at in a second. Now, think of this from a housekeeper's perspective. The housekeeper comes up, walks up, or I walk up, I touch that door handle, I'll leave something behind the door handle. And then the housekeeper walks up, takes their good cleaning cloth, right, takes their good disinfectant, wipes that door handle. Well, what have they just done? Broke the chain of infection. Which leads us to the chain of infection. And I think this is key, and we're going to talk a lot, we're going to talk here about training and stuff as we move along. But I think it's important. This is a real foundational piece of understanding cleaning for health. Is understanding how infections spread. I'm not going to go into significant detail about this, but this is what we call the chain of infection. A lot of you have probably seen this before. So it's required for an infection to spread. And I think what's important is, as you go through this, you always look for the opportunity to break the chain, and people forget how much environmental service does break the chain, or has the opportunity to break the chain. But again, before an infection is spread, we need infecting agents, we need a reservoir people. It can be inanimate objects, it can be surfaces and such as well too. We need a portal of exit, a way for it to get out. Influenza, COVID, common cold, respiratory, sneezing, coughing, talking. Ways for it to get out. We need a mode of transmission, right? The three primary modes of transmission to remember are, droplet, which we know COVID was, airborne, which we think COVID might be a little bit. We're not, it's still not conclusive on that one. We know droplet for sure. And then you have your contact, direct and indirect contact, where touching surfaces or directly with individuals. You need a portal of entry. Remember your mucous membranes, your eyes, your nose, your mouth, right? Ingesting, depending on what it is. And very importantly too, we need susceptible hosts. Our vaccine programs across Canada are working to take away the susceptible hosts so infections don't actually occur. So importantly is understanding that, and without getting into a lot of detail on it, is very importantly understanding where and how we can break the chain in each one of those areas. So some of the critical building blocks that we know we do need in order to have, to develop an effective and efficient housekeeping and cleaning program that's going to create that healthy environment for us, right? Obviously, we do need safe, effective cleaning and disinfecting products, right? That's going to be key. We need proper tools, right, to execute each procedure correctly, right? That's going to be key as well, too. So important, right? Very, and even more important as we go up the line here is specifically design cleaning protocols and processes and procedures, right? Those need to be in place. We can have the best tools, right? I can give you a whole system of microfibers, but if I don't have the right protocols or procedures in place for how to utilize the system, you're not going to get the benefit of it. So we need to have that, and we need, very importantly, and more importantly, well-trained staff. And I say well-trained and motivated staff here. Well, if we train staff, if we invest in staff, we're going to help to motivate staff, right? Create that environment. Can't stress enough the importance of the training of staff. We can have all three of those in place with the best cleaning protocols and processes and procedures in place, right? But if the staff aren't trained and the door handle doesn't get wiped when it's supposed to get wiped, it doesn't matter what we're using, right? So making sure our staff are well engaged. And very importantly, to create that continuous quality improvement is looking at, measuring results. We have to continue to measure our results, both from a visual perspective and from a sort of invisible perspective, if you want to look at it that way as well too. So how can we build, data-driven continuous improvement model, right? And this is not necessarily rocket science. This is something that is, just getting back to basics. Again, let's take a step back while we have the chance and let's reassess. Let's assess where we are today. We're going to go into more detail on these in the next slide, so I'm just going to go through this as an overview. So let's assess where we are today. Once we assess where we are today and where we want to be and what we need to achieve and where the gaps are, right, we can then design a program that's going to fill that gap for us. Call it a gap analysis would be an old phrase that would be very relevant here. Very importantly, from an implementation perspective, we'll talk about the importance of implementation, right? When we design the programs, 80% of all programs fail in implementation, so implementing is key. And then continuous optimization, right? Obviously, we're not perfect. We never will be perfect. And our cleaning programs will never be perfect. And so we need to be continually optimizing them. And then very importantly as well, validating, right? And even more so today, validating in such a way that we have information to be able to take back, right? Whether it's to, a health inspector that comes into our environment, or it's a family, or it's a resident, whoever it might be. Here, we're doing what we say we're doing. We validated this. Here's the proof of what we're doing, right? So important. So moving on and getting into a little more detail about this. So, from an assess perspective, right? Let's again, first and foremost is assess. And how do we assess, right? We want to find out what our current state is and figure out what our desired state is. We assess by walking our building. We assess by looking at the areas we're cleaning. We will look at building size, number of beds, right? Entrances. People forget about the importance of managing their entryways. Can be critical. Different surfaces. What are the current cleaning protocols that are in place, right? What our current staffing plan, right? Does it still make sense? As we've had to shuffle things around to provide more enhanced cleaning in more critical areas. And what equipment and chemicals are in use today, right? Do they still make sense for our environment today? Are we using disinfectants that have 10-minute contact time when we should be dropping down the disinfectants and newer technology that provides reduced contact time, down to as low as a minute? For proper disinfection, right? So different things that we want to look at. And very importantly, to identify, priorities. And, a couple of things is identify is where we sort of want to get to from a cleaning perspective. These are the resources we have. But where do we focus our energy? And, PIDAC, if you're familiar with PIDAC, the PIDAC document for environmental services in healthcare. They have a great assessment tool in there, which helps you to quickly identify is where your priority cleaning protocols are. And there's lots of tools out there like that. So we walk into an office in our home and we look at a garbage can. Is that high priority, medium priority, or low priority? Well, obviously low priority, where the door handle, right, or the handrails and the corridor are high priority. It helps us to prioritize ourselves and understand where we might be able to improve on our cleaning processes to get more towards that healthy environment. And we want to be sure to include all stakeholders in the assessment. So important. Everybody from management, administration, all the way down through. And I don't want to say all the way down through. I think most important is to include your frontline workers, right? Because they're the ones that are on the front line. They're the ones doing the work. They're the ones that know where the challenges are. Once we have that, right, then we can look and design, right? Remember our building blocks. We need good cleaning and disinfecting products, good tools. We need good protocols and procedures. We need well-trained and motivated staff, right? And we want the ability to measure results, right? And so as we go through this, we want to keep those in mind, right? Keep in mind during the plan developments, right? And it doesn't have to be complex as well, too, right? Sometimes it's simple as a chemical improvement, right? It's simple as a cleaning tool going from a cloth rag to a microfiber. Surprisingly, I've been seeing a lot of locations that I always thought everybody was on microfiber today and using microfiber for cleaning, and that's not necessarily the case out there, right? So can we improve that most common tool that a housekeeper uses, for example, which is the cleaning cloth, and give them a better tool that helps to remove more soil, both visible and invisible, right? The stuff we can't see. Automation, obviously, is always a great thing to look at. Are there frequency changes that we need to make, right? Are we emptying garbages every single day, right, in an office? Do we need to do that, right? Are there frequency changes we can make in certain areas based on that assessment that we did, where we looked at the priorities for the different areas that we need to clean? Do we have the right training programs in place? And do we very importantly, have the right methods for measuring and monitoring our QA for both our visual, right, and something like our, whether it's ATP or microbial simulation auditing, right, to monitor process as well, too. Never underestimate the importance of innovation, right? Innovative solutions. It's really time to take it seriously. It does make a huge impact, or can have a huge impact, right? And always staying up on what the new innovations are, right? Watching out for the snake oil out there, obviously, right? There's a lot of stuff that comes to light when something like COVID hits, but making sure that we are really focused on, what are those quality innovations that are going to help us to make game-changing, improvements to our processes and our outcomes, very importantly. A key to enabling, as we call it, a future first approach, right? Very proactive approach. And no longer just nice to have, we have to have them, right? We need them, and whether it's as simple as that microfiber cloth, like we talked about, or it's electrostatic disinfecting for that secondary disinfection step. being able to do it more frequently, more efficiently, critically important, right? And it was huge through COVID as well too. Autonomous cleaning is something that's happening now as well too. We'll talk a little more about that in a second. There's smart cleaning programs out there, right? Database, analytics, database-driven analytics that'll help us to track what we're doing and then identify through insights, various insights and various tools, and taking that data, turning it into useful information to help us to say, hey, I can quickly see, here's an issue, here's where I could make an improvement, here's where I could tweak something. You know what? Sometimes as simple as a food safe no rinse disinfectant. People were using food safe sanitizers in their dining rooms and were forced to switch through COVID to disinfectants in their dining rooms, which added a whole new step where they had to rinse all the tables after they used the disinfectants. Was happening prevalently in Ontario, right? So a no rinse disinfectant that's food safe, right, was a big game changer for a lot of facilities too, because it eliminated a task. Autonomous cleaning. Obviously we can implement, we'll call them, say robots. We call it autonomous cleaner, cobots, right? They become co-workers of our staff, can deliver definitely, obviously, high quality cleaning, more efficiently, right? It's no people involved. There are very little human interaction, right? The automation is very predictable. It does the same thing once you teach it or you map it. These machines do the same thing every time. We can increase cleaning frequencies. And automation today is really focused on floors. And keep in mind, for housekeepers, maintaining floors is probably the most. Housekeeping is a very labor-intensive. It's a hard job, and maintaining floors is one of the toughest parts of that. And our automation in automated equipment today is really focused on floor care, whether it's a large auto scrubber, which might not make sense for most long-term care or most senior living facilities out there today or homes, but then smaller, more versatile vacuums, automated vacuums, like the Wiz that can have a great impact on, you think about it, a cobot where you have a automated vacuum going through, doing the corridors and doing that heavy work, while you have the co-worker to that actually being able to focus on more important tasks like contact point cleaning, and going through and doing more frequent contact point cleaning and detailed cleaning in those areas. In addition, they're very predictable, and they provide us with a lot of information on insights as to what they've cleaned, how they've cleaned. We can always utilize those insights again to maximize the efficiency of that investment, and it creates demonstrable results that are, again, that proof of clean. We're able to look back and say, yes, it did this, and yes, it did this frequently, and covered these areas. Right. So, and autonomous cleaning is very new in the cleaning space. In the last couple of years, really out there, and it's only going to get better. It's only going to improve. It's only going to be more and more become available, and so something to really start to look at now and pay close attention to. Right. I always say 80% of all programs fail in implementation. We can have the best stuff in place, but if we don't have a good implementation plan to put this in place, it's not going to work. We need to be persistent. We need to be consistent. And we need to keep the emphasis on. We're trying to implement change, and that can be very challenging if we don't have that plan in place, right? That that involves all the stakeholders, right? That celebrates the wins, right? That creates the milestones, celebrates the wins, right? Keeps the team motivated, and continually is reinforced, right, as we go through, right? That our plan is not going to work. So that implementation plan is key. And even more so, I put the key at the bottom here, and this is probably one of the biggest keys, is train, then train some more, right? Invest in your staff, and provide that training to your staff, and whether it be, through hands-on sessions, whether it be through online, we want to make sure that we are really focused on the staff. So, and those tools that are available today, one of the things we learned through COVID is that, we can do a lot of training, right, remotely. We can do it through facilitated training sessions, with some of your vendor partners or some of the experts out there that can provide these sessions as a facilitator, or very importantly as well too, we can utilize many of the online tools that are available out there today to get staff to go through various training programs themselves, a little bit of self-education. Importantly, on systems that allow us to monitor their progress, to see how they're doing, to see how they're scoring, right? With that continuous follow-up with them as well, to make sure they are achieving and getting the results that you're looking for out of those types of training sessions. And, we can really focus as well too on different certifications or, programs that are they have some sort of structure to them. For example, SIMS, right, which is the ISSA Clean Industry Management Standards, right? So actual standards out there that allow us to make sure that we are providing the right information to our staff as well too. We're not perfect. We never will be. Our cleaning programs will never be perfect, and we need to continually optimize. We need to continually adapt to the changing situations. Again, like COVID showed us in such a significant way. What a way to get a wake up call to say, yeah, we definitely need to be able to adapt, and we need to be able to adapt quickly. Again, no cleaning program is ever complete, right? We review every year, or even more frequently, or whenever cleaning requirements change. We have to adapt continuously, not just to COVID, but to, it's influenza season again. It was not prevalent much because nobody was going anywhere. And the same safety protocols and the same, masking and such we were putting in place for COVID also prevented the spread of influenza, but influenza is back and it's not going away. Same with our MRSAs and our C. diffs and such as well too. We know changes are inevitable. Again, being very prepared to adapt to those changes is important. And I love this phrase is, continually inspecting what you expect. And that's that monitoring, and that's that process of validating that we are, if we're trying to achieve a certain objective, that we are measuring against that and making sure that we are monitoring and inspecting that as well too. And then the validation, in validation, hey, if you're validating, based on a, visual audits, and you're doing it on a paper-based system, great, right? You're validating, right? Validating again that we're doing what we say we're doing, and we're creating those tools, right, that allow us to be able to show and show our residents and show our resident families and show the ministry, right? Show the health departments that we are doing what we say we're doing. Very importantly, though, is in today's day and age, right? There are programs available that can, you don't have to be a large facility for it to make sense. It can be the smallest type of long-term care home in rural Alberta, right? That could benefit from some of the programs that are available out there to allow us to validate what we're doing, right? And as we validate and we timestamp the various activities, right? And we manage tasks, and we manage cleaning processes, we manage routines, and then we are to timestamp against that and validate real time that our staff are doing and following the processes. Again, provides that data that allows us to very quickly look to see where we may have gaps, where we may need to identify training needs, identify routine changes that allow us to be more efficient and to focus more on those high quality tasks, right? So smart cleaning programs and management systems, like I was just talking about, right? They can, mitigate risk, help us to maximize efficiency and effectiveness, help us to mitigate risk, detailed reporting, because now we got a lot of data that we can turn into useful information. We can leverage those analytics again to, I think so importantly is just to summarize this is when we track, when we measure against results or measure against objectives and measure what we're doing and what the expectations are, right? Provides us with, and we do that in a data-based format, it provides us with that ability to now, as opposed to a file full of paper that we've done where we've done audit trails, whether it's the visual audit or it's MSA microbial simulation audit, we now have robust data in a centralized area, right, that can provide great insights for how we can fill gaps, how we can make improvements, how we can continue to drive forward and create cleaner environments, how we can continue to make sure that we are preventing the spread of infection through our environments, right, as opposed to controlling it, right, and how we can demonstrate that to residents, to resident families, right, and to the ministry, to whoever it is that we need to show, hey, this is what we're doing, and this is when we're doing it, and this is how we're doing it. So apologize, did run a little over, but and just simply putting it all together and just with a very quick summary again, right, and running through this, and I'm going to stress again here the importance of environmental service. I'm going to stress again is go out and I know today we can't hug our housekeepers or high five them, but they're the heroes out there on the front line from an environmental services perspective. They save lives, and so important that we recognize that on a consistent basis, and utilize a process like our Confident Clean process, which can take you through this. Our teams across the country that can run through this whole process with you, right? We do it for we do it for the residents, right? We do it for that healthy environment. We do it for our staff, right? We do it for the visitors in the facilities. It's our responsibility to help create these healthy environments that are safe. And so take the time to go back and reassess and just see what, there's always ways we can improve, always things that we can do. This process will help take you through that on a continuous basis to create that continuous quality improvement that where we can continuously measure and continually make modifications and adapt as we need to and as changes take place. So I want to thank everybody very much, and I think I'll turn it back over to Angelica.
That was great. Thanks, Bruce. We will now begin our Q&A session. As a reminder, please use the chat box on the bottom right-hand corner of your screen to type in your questions. Just be sure to send them to me, Angelica Bellavia, or to all panelists so I can ask them to Bruce. If you can't stay for our Q&A session, that's no problem. We will be sending out a copy of our outbreak prevention guide, as well as a recording of this session to all attendees. If you have any questions or would like more information about any of the topics we covered, please email us at askus@bunzlch.ca, and we'll be happy to provide you with an answer as soon as we can. We also have a range of downloadable guides that are applicable to long-term care. So if you'd like, including our hand hygiene guide, so if you'd like a copy of any of those, please include that in your email. Now on to the first question. So our first question is, does Bunzl offer training for cleaning staff?
I guess that's for me to answer, right? Question answer period. Absolutely. Yeah, absolutely we do. And we offer that in the different methods that we talked about as well too. These could be training sessions that are facilitated hands-on. And I still, believe that there's extreme value in that hands-on face-to-face training, but that's not always possible today. And so we've done a lot of training. We've developed a lot of training programs that are able to be facilitated, facilitated remotely or using our Confident Clean platform as well too. There are online training programs that are available as well too, that can be self-administered or self-taught programs that can, and not just importantly, not just an ad hoc program. Like it can actually be a full sort of a process of training, right? Taking somebody through 6, 7, 8 modules that are customized to meet the needs of your particular environment.
Next question. What is the food safe disinfectant?
Oh, excellent question. That is Clorox Anywhere is the product that you are looking for. It is available, and designed specifically to be used, well, I shouldn't say specifically, but it's designed to work effectively through with electrostatics. So if you have, the T360 or an electrostatic sprayer of some sorts out there, it's designed for use through that. In addition, it is also available in a ready-to-use format for a spray and wipe. Or a filter wipe.
Thanks, Bruce. You mentioned measuring results of enhanced cleaning. How? What metrics are used to determine such results?
You know what? There's a couple of ways that we can do that, but one of the best ways to do it is we don't do enough of this, I don't find, is actually job shadowing, right? You need to watch what our staff are doing, right? Visually making sure that they're doing this is something that is one of the best ways, right? A couple of things it does is not to intimidate staff by you shadowing them, but again, if there's different ways that we can measure, how we're doing on a particular surface. Right, we can utilize, and if we want to look at it from an invisible perspective, we can utilize ATP, right? But that's tough to do broad spectrum through the environment on a regular basis, right? We can do MSA auditing, right? Which microbial stimulation auditing, if you're not sure what that is, it's use something that's a fluorescent product that is visible with a black light so you can go and you can grade, you can stage an area to make sure that your staff members are covering all that. But again, I think some of the simplest ways to do that is just simple monitoring from a visual perspective, right? And working with your staff, right, on the front line to see what they're doing and making sure that they are achieving that result that we're looking for and completing the tasks.
Great, thanks, Bruce. Next question, what are the ingredients in the Clorox disinfectant?
Ingredient, so if you're referring to what are the active ingredients in the Clorox disinfectant, excellent question, because people hear Clorox and they automatically think, oh, it's bleach. When in actuality, there's 3 different products within the Clorox line. So the T360 is actually a quaternary-based disinfectant. I call it a quat on steroids. Conventional quats, tend to be a longer contact time, and tend to be, a bit of an older technology with some gaps in their efficacy, meaning not effective on non-enveloped viruses like norovirus. T360 is a quat that is, a 2-minute contact time, effective on non-enveloped viruses such as norovirus. So that's the T360 product. There is a product that is a bleach-based product, which is the Spore Defense, which is specifically for that. C. difficile being a spore-forming bacteria, very difficult to kill on surfaces. That's what that particular product for. It is sodium hypochlorite-based. And then there is the Clorox Anywhere, which is a hypochlorous acid-based product. And don't let the word term acid fool you. It's a neutral product. Very safe product to use as well too.
Thanks, Bruce. Our next question is, what are the data-driven analytics?
So data-driven analytics, great question, right? So as we go through and we start to utilize programs that guide us through our cleaning routines in a day, or guide our staff through cleaning routines in a day, and recording those cleaning tasks. So let's say we have a routine that we're supposed to do, right? That involves, these 30 rooms, right? These 30 washrooms that are in these 30 rooms. And I know I say 30 rooms, and I think all you're sitting out there going, yeah, that's about right, even though it is a lot, right? And all the tasks that are involved with that, we have those routines set up, and for a staff member to go through and do. And we have the ability for them in some fashion. And this is more and more, we see technology getting into housekeeping where real time they go through and they finish cleaning room 101. They mark off, boom, finish cleaning room 101, right? When they do that, and when you have that ability, when you do that from a data perspective, we now timestamp, right, when they finish that room. And we do that, and when we do that through our environments, through our facility, we start to timestamp and create data on, are we completing our tasks? Are we getting through all of our cleaning in a day, right? Are there things that were being missed in a day? We can really start to identify where we have gaps, right, in our cleaning processes, or where potentially we have a routine or a staff member that definitely has more work than is there. And that's from a monitoring standpoint and a validating standpoint. Proactively, even before that, right, we can actually go through and we can use a lot of different standards to measure a routine and to measure exactly how much time a particular routine or a particular task, right, should take. And utilizing that information for us to be able to design our routines effectively. So we, understanding we got to be efficient, we got to be quick. Again, housekeeping is not easy work. We don't have extra time in a day, but making sure that we aren't overloading our staff. But as we start to collect all of this data from a cleaning perspective and entering this information into that format, right, we can then start to look and say, it's taken us this amount of time to do this. It's taken us this routine. We continually are not able to finish by the end of the day. Why is this? Why are we missing this stuff in here? And then we can go back and start to revisit it, through job shadowing, right, through utilizing cleaning time standards to say, does this make sense, right? So that's where we can utilize this data from. And that's from a standpoint of, and apologize expanding on this, right? But that's from a standpoint of when we look at the analytics from data we collect from what housekeepers are doing. We start to implement, autonomous cleaning products like an autonomous vacuum, for example, right? And now we can start to look and make sure and utilize the data that's coming from that, right? To make sure that it is running as frequently as we want it to be running. So we want to get 3 or 4 hours of use out of this a day. Is it running for those 3 or 4 hours? Is it able to complete its maps, complete its cleaning tasks, right? Or does it get stopped a lot? Are we running it at the wrong time of day, right? Where there's too many people around, right? And so lots of different analytics that we can gather, right? That can help us, right? When we start to record this information into a robust system that will track it all for us.
Great, thanks, Bruce. Our next question is, we currently use the J-Fill Oxivir for cleaning and disinfecting. Is there a similar product with a shorter kill time?
So that would be Oxivir Plus through the J-Fill platform, which would be a 5-minute contact time that you would be looking at. Getting below 5 minutes, yes, you can get below 5 minutes. You can actually stay with the Oxivir line, with the Oxivir TB, to get below 5 minutes. But when we start to try to get below 5 minutes, we start to get into, and not a bad thing necessarily, but we start to get into ready-to-use products. And the reason ready-to-use products tend to have a lower time for efficacy for actually killing what it says it's going to kill on the surfaces, right, is because it is controlled, right? When they make it, it's controlled. It's not diluted on site, right? So you end up with, being able to get those shorter contact times, right? But, to my knowledge, from the standpoint of getting, again, below that 5 minutes, again, you're getting more into the ready-to-use products, right, that do get you down there. But you can get as low as a minute contact time.
Thank you. Our next question is, what is the best way to introduce the digital tools you mentioned to our cleaning teams?
Ooh, great question. It comes through our implementation process, our planning, and training them on it, and getting them to understand it's everyone. When we look at, and let me back up for a second, when we look at introducing it to them, making sure, right, that they understand this is not about Big Brother wanting to watch to see what you're doing. This is about us, right? Again, helping you to have tools available to you, right, that are going to provide analytics that are going to provide us with more information to, one, offer continuous quality improvements, look for opportunities where we do require more efficiencies, and potentially do require some innovation or something to help us out to identify where we have maybe unbalanced workloads through the environment as well too, where we have staff members that are potentially do have more in a day than they should have, and we need to make adjustments. So really, it's helping them first to understand that there's a lot of benefit that comes from this. It's not just Big Brother watching, right? And then importantly is definitely that training aspect, right? Making sure that they understand the tool, and it's in today's day, it's simplicity, right? Most of these systems are like our Wanda Mobile, for example, is very GUI, a very graphical user interface. It's point and click, it's icon driven, so extremely easy for staff to train them on, and for most staff, right, to be able to adopt very quickly, right, to be able to enter the information into the system as they are using it.
Thank you. Our next question is, after the 5-minute contact time, are we supposed to wipe it up?
So if you look at some products after the 5 minutes, right, they might say to do a rinse on the surface. If you are using a disinfectant that is not a food safe disinfectant in a food service area, like a dining room or such, even though dining room tables aren't necessarily a food contact point, but you do have the risk of residents dropping food and possibly eating it off the table, then yes, you should be doing a rinse afterwards. In general, right, we do not rinse surfaces after we apply our disinfectant. We leave it sit for its 5-minute wet contact time, right, and then we kind of walk away while it is drying. Certain products will recommend a rinse at the end of it. The best thing to do is actually to read the label and see what that product says. And that becomes important in your selection of your products as well too, is just understanding, what the application is of the product and what the use recommendations are. Because obviously if we're using a product, right, that has a 5-minute contact time, what we're supposed to leave it for 5 minutes and then we have to rinse afterwards. Maybe we should be looking at an alternate or looking at something different where we don't actually have to rinse the surface afterwards, because that adds a whole extra step. And remembering back to protecting building surfaces as well too, right? We don't have time to rinse surfaces. We use a product that requires rinsing after after use every single time. And, we don't get to it because it's not something we have time for. It's going to start to degrade our building surfaces potentially as well too. So just important to understand and upfront that the products that we're bringing into our building and what the use requirements are.
Our next question is, do you have any automated floor cleaners available for sale now?
Yes, we do. It says there's either from an auto scrubber perspective, so say for hard floors and for actual wet cleaning of surfaces, they tend to be larger units. There's still a fair amount of cost associated with autonomous equipment, and very importantly, we're never going to put an autonomous piece of equipment or recommend it to and our vendors aren't going to do this as well too, or recommend it to an environment where you're not going to be able to get a return on investment, right? But they tend to be larger auto scrubbers. But for more of the senior living space, right, there are vacuums, and we do have specifically a vacuum available that's both good for hard floor and for soft floor. So for carpet, that is available today, where it's fairly easy to get a very good return on investment, both from a financial perspective, but also the optics of as I was touring around a couple of homes this week, right? And it's the first time I've been in a long-term care environment where they actually had empty rooms and empty beds, right? Because not because there isn't the people out there to get in them, but there's people there's hesitancy. Because normally in long-term care environments, your higher level of care environments, there's waiting lists to get in, but loved ones are holding their loved ones back because of what they don't feel is necessarily a safe environment for them to be in. And so you think of you utilize autonomous cleaning for the consistencies and all the rest of it. From an optics perspective, though, it's felt too when when you have family members and residents or potential residents that come into your environment, to your home, and they see this autonomous vacuum going, right, and they see the technology being used, and then they see the person right beside that utilizing, right, the time to be able to clean the contact points, right, and do the frequent contact points and door handles, right. And again, it's that proof of clean. Optically, it's extremely important. It's a great thing to be able to tell your residents and your resident families that, hey, this is what we're doing, right, to make sure that we are creating and maintaining this healthy environment.
Great, thank you. On the same note of autonomous cleaning, how much supervision is required to use a robot vacuum? We are a dementia care facility and need to be conscious of elderly safety.
Fantastic question. And that goes back to where we talk about autonomous cleaners and like this let's focus on the autonomous vacuum in this particular case, because that would be the application. It's a cobot. We don't, today it's not like there is a little bit of AI in there. There's a little bit of learning that the unit can do on its own, right? But it's not a fully autonomous unit from a standpoint that we just started and let it go and it opens doors and all the rest of it. A couple of key things is one is there is interaction with the vacuum will come in a couple of ways, right? It'll come one when it finishes its routine and it finishes the one map and needs to be started on the next map, right? That's it completing its clean. Next will be if it gets stuck somewhere where it's not able to negotiate around. Keep in mind that these autonomous vacuum or these autonomous equipment that's out there, one of the primary focuses is safety. And so you think of a dementia ward without question, right? From a safety aspect, right? People jump out in front of the unit, it's going to stop, right? People want to touch the unit and tamper with it, it's going to stop, right? So safety is primary for this. But again, too, our staff member is never far from this. And if the unit does encounter any issue, it communicates with the staff member, whether it's through a pager that's available with it, or even better, right, through text message or email, right? Or text message is usually how we do utilize it. So it'll communicate with text message saying what's wrong, what it needs, and it won't start up again until it gets the attention that it needs, so it knows it can operate safely in that environment. But I think very importantly for that particular question is, again, your operator is not far from it, and interaction doesn't need to be watched continuously, but you want to be close by, right, in case something does happen. But from a standpoint of it gets into a situation that it can't negotiate.
Thanks, Bruce. We just have 2 more questions. First, are there any new cleaning tools that help reduce injuries?
Yeah, autonomous vacuums, right? Because now we're taking away, those things that now we're taking away, and that's going to the extreme, but definitely new, right? To help us to reduce injuries because keep in mind, again, very labor intensive. Housekeeping is very labor intensive work. Our staff work hard, not just from a standpoint of the amount of work they have to do, but their body works hard. And so workplace injuries are paramount in housekeeping, and the some of the most labor intensive work is maintaining floors, right? It's vacuuming, right? It's mopping floors, and so if we can take some of that away, then when you look at an autonomous vacuum, for example, you can take away dust mopping on hard floors, you can take away vacuuming to a large degree, right? Where it's only detail work that has to be done after by the housekeeping staff. So I think that's a key. But again, we don't need to always look at and today it's not always necessary. You don't have to go to that kind of extreme. And I wouldn't say there's anything necessarily new out there outside of the autonomous cleaning, but there is still lots of things that we can look at, very simple things that we can look at that sometimes we don't do today. Right, the amount of adjustable handles that are out there for mop handles, right? Whether it be a flat mop or whether it be a conventional Kentucky style mop, right? String mop system, the mop and bucket that you're using, right? Adjustable handles can make a significant difference because what handle doesn't, 154-inch handle and a 60-inch handle, which are your 2 conventional choices, only fit people that are a certain height, and that's 2 heights, right? And so adjustable handles can be huge for helping staff, right, to help prevent workplace injuries. And in addition to that, I think more importantly, or very importantly as well too, is one of the things that we do when we're doing a lot of our different training sessions and such as well too, and going through the procedures and processes is staff can, especially people who've been doing it for a long time, have developed bad habits of always leaning over and looking down, always bending at the back. Right, and so really focusing on sessions and training sessions that can take place that are specifically around how can we be more ergonomic in our approach, right, and in the tasks that we do, everything from how we grab onto a cloth, right, to prevent carpal tunnel, right, and such as well too. So I would say from an autonomous perspective, yeah, very new, but I think a quick reassessment. Let's go back to reassess. Quick revisiting to look and say, hey, what's available that we don't know is there today as well too. I think would be the way to put that. Sorry with a long-winded answer.
And our last question is, how can you tell if your cleaning program is or isn't working?
Excellent question. Is working. The building is visually clean, right? The building in our home, right, doesn't have odors. So there's all the visual aspects and all the visual cues that we can take, right? From our quality audits and going through and visually looking at those visual audits. I think that's obviously a big key where we can see where it's working from a standpoint that, yeah, we are doing the cleaning that we're supposed to be doing, right? Our floors look good. Our place doesn't smell. We're not getting odors. And I think so that's the obvious piece. I guess from the more unobvious piece is, how is our cleaning program working is somewhat can be measured by a couple of ways to do with this, right? So some buildings are fortunate and have great cleaning programs in place, and they're able to prevent any outbreak from happening. Remember, an outbreak is classified once you have the spread of an organism once. So you go from one person and you determine that resident 101 has given it to resident 102, right? And so you have the homes that have good, robust cleaning protocols in place and processes and monitoring that they're able to don't have an outbreak come in. But you can also have the same building that has the great robust cleaning processes in place, right? That sometimes you just can't prevent it, right? Nothing's perfect, right? And so something comes in, somebody comes back from the hospital, right? Brings something in that we're unaware of, right? Remembering we're most at risk when we don't know something is there, right? So, but the next measurement comes from that is, right, is how quickly, right, do we get that under control as well too, right? So does it spread rampantly through the building? Understanding that, infection prevention is broad spectrum, right? It's hand washing, it's hand hygiene, right? It's proper use of personal protective equipment. It's, it's our cleaning protocols, right? It's, a number of different things that are put into place, right? But, are we preventing infections from getting into the environment, or very importantly, are we preventing them from spreading through the environment? And then, setting up some sort of program as well too, from a healthy, clean standpoint. So you are doing some sort of auditing process, whether it's microbial stimulation auditing, or it's using ATP, right? Just to validate in some fashion that our staff are touching the points that they need to be touching, that they should be touching, right? And again, not to point a finger at staff saying, hey, you're not doing your job, but to, identify training needs, right? Identify areas where we can continually improve. I hope that answered the question.
It definitely did. So those are all of our questions. I would just like to take this opportunity to say a big thank you to Bruce for presenting this session, and to all of you for attending today's masterclass. I hope you all have a great day.
Thank you, everyone.